Welcome back to Sleep Better TV. I'm Scott Drake, and my guest in studio is Dr. Larry Pribyl with the Center for TMJ and Sleep Apnea in Independence, Missouri. And we're going to begin a series of discussions on the problem of sleep apnea. Dr. Pribyl, welcome. How is a diagnosis of sleep apnea typically made?
Sleep apnea is diagnosed by the use of PSG, which is a polysomnographic test. You go into the hospital or a freestanding sleep lab, and the sleep labs run the test. It's an overnight stay. There are many items that are and functions that are monitored through the course of the night, and the end result is a sleep numbers that tell the number of times that you have interrupted your breathing, or maybe other factors that they find. But that's the basic way that sleep apnea is diagnosed, and can only be diagnosed by way of a sleep study.
And Dr. Pribyl, typically what factors are monitored or observed during a sleep study?
During a sleep study, one of the factors that is monitored is your oxygen level. And oxygen levels through the course of the night, we like to see be 90% or more. And when they drop lower than that, that's a strong indication that apnea is part of what you have going on. Also monitored is your heart rate. When apnea events occur, heart rates tend to race and increase. Also, there are your muscles jerking and clenching, and whether it's facial muscles or leg jerks, those are monitored also.
And are there any other ways you can diagnose obstructive sleep apnea?
One other way that is very common and becoming more popular is an ambulatory or a take-home sleep test, and that is done in the comfort of your own bedroom. The take-home sleep test doesn't monitor all the things that a PSG does, but the most important thing that we're interested in is the obstructive apneas that are happening. So there are many fewer leads and fewer connections to that you are hooked up to, but that allows us to measure the obstructive events, which are most important in regard to the dental field.
And finally, doctor, what's the range you expect to see in regard to the severity of sleep apnea?
The sleep apnea is measured by way of counting the apnea-hypopnea index, which apnea means the cessation of breathing. Hypopnea is a decrease in your oxygen level. They combine those two, and if you have less than 5 events an hour, which reflects as 10 seconds or more if you stop breathing, less than 5 times an hour, you're not considered to have apnea. If you breathe or stop breathing between 5 and 15 seconds an hour, or 5 and 15 times an hour, that is reflective of mild apnea. 15 to 30 times an hour is reflective of moderate, and anything greater than 30 times an hour, that is severe apnea. So apnea is monitored and graded in those terms, and needless to say, the more mild and moderate the apnea, the easier it is to manage and monitor and to keep under control.
Dr. Pribyl, thank you.
You're very welcome. Thank you.
Again, my guest has been Dr. Larry Pribyl with the Center for TMJ and Sleep Apnea. He practices in Independence, Missouri. I'm Scott Drake, and this is Sleep Better TV.